Hi, I am Dr. Dikshit Kumar Thakur, pulmonary critical care and a sleep specialist. Today I am going to talk about insomnia. So, what is insomnia? It is poor sleep quality or inadequate or insufficient sleep quantity with either you are having difficulty in falling asleep, difficulty in maintaining sleep, or difficulty in getting up. Generally, in normal adults, we usually take around 10 to 20 minutes to fall asleep. But these insomnia patients generally take more than 30 minutes to fall asleep. Now, how it is different from sleep deprivation? So, a patient of sleep deprivation is generally don't have the time to get the enough sleep. Like he's too busy in his work, says that he don't get the time for the complete sleep. But the insomnia patient, despite having the complete time of sleeping, he is not able to sleep on his own for the full duration. So what are the various features which these insomnia patients have? So along with the sleep difficulties which we already discussed, these patients will have the daytime symptoms like generalized fatigue. Whole day the patient is fatigued, he is feeling lack of energy, poor concentration or attention deficit, he is not able to concentrate in his work. Along with that, mood swings. These patients generally have a lot of mood swings because they are not having the enough sleep and enough rest. So insomnia can be broadly classified into two types: the short-term insomnia and the long-term insomnia. Short-term insomnia means when the symptoms are persistent for less than 3 months. And these patients generally have some acute stress condition, like there is some work stress which has newly come up, there is some personal stress, there is a change of place, change of work. So there might be a fixed triggering agent which you can correlate with the insomnia. Whereas in the chronic insomnia, the other type, the symptoms are generally persistent for more than 3 months and they are having at least for 3 days per week. So these patients generally are having these symptoms variable. Few nights are good, few nights are bad, and their symptoms continue to persist. Now there are various risk factors and the comorbidities attached with the insomnia. So insomnia is a disease, but sometimes it is associated with multiple other comorbidities which needs to be looked into so that we can treat it properly. So one of the most common diseases are psychiatric illness like depression, anxiety, post-traumatic stress disorders. If patient is suffering from these conditions, the insomnia can be part of that. Hyperthyroidism. So thyroid abnormalities, diabetic patients, they can also have these symptoms. Steroids. Patient is on various drugs like steroids, sedatives, antidepressant drugs. So these are the few things which needs to be ruled out and which needs to be looked into before labeling a patient a pure insomnia and not the other disease. Sometimes the insomnia is associated with the sleep apnea. So that also needs to be looked into. How to diagnose it? Generally the diagnosis is by the history taking only. By the patient, whatever history he is telling us that I am having these symptoms from this much of time, this is the triggering agent. So that will be the basis of the diagnosing insomnia. Sometimes if we think that there is some secondary issue like sleep apnea, so then sleep study might be needed in that case. So once we have diagnosed the insomnia, we have identified the triggering agent. So if there are diseases like depression, so that needs to be treated first. And along with that, the insomnia will also be corrected. And in some cases, the first therapy ideally would be to rule out these causes, treat them. The second level is cognitive behavior therapy. Behavior therapy is nothing but helping the patient to cope with the condition. We will teach them the sleep hygiene, the way we should sleep, the fixed timing should be there. We should not use sedatives, we should not use alcohol or caffeinated agents. So just a basic sleep hygiene will help along with the cognitive behavior therapy, and some specific medications are also there. In worst case scenario or in the severe cases, we use a combination of cognitive behavior therapy along with the medications to treat the patient. So if you are having the symptoms, ideally you should meet your sleep specialist or a neurologist. Thank you.